That said, of course, there are cardiothoracic intervention surgeons using what's called shockwave therapy. I met one in London, and it's ironic we're using the same terminology. I clean tubes and pipes in refineries, and he cleans tubes and pipes in the human body. Yet our terminology is very, very similar. And this shockwave therapy, I've used something similar to unblock crude oil pipelines, but using ultrasound with ultrasonic transducers, so to speak. These probes that go into the artery itself try to create a sound wave, a shock wave inside. Now that's all well and good. I hope I'm not digressing too much here, but with shockwave therapy, you really want something that is brittle, not ruberoid, not soft and pliable, because that simply absorbs the sound waves. You want something that actually creates impact.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. William Pollack, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode was previously recorded on the Pain Solutions Summit that I hosted. Welcome today to this segment of the PEMF Summit. Today I have with me an interesting individual who didn't come to magnetic therapy in the usual way. And I'm not going to introduce him. I'm going to let Mike Watson introduce himself. And I have him here because I think he has a very interesting story and a lot of interesting experiences using PEMFs. And he uses PEMFs in ways that I wouldn't use, not necessarily that I shouldn't use or I couldn't use, but I think he's doing it in a way that's also his results speak for themselves. So I'll let Mike do the talking.
Okay, Bill, thank you very, very much. So to answer your initial question, how do I use PEMF differently? Let's go back about 7 years. For my part, I'm a serial inventor. That's what I'm really, really good at. Pretty pants at everything else, so I delegate to people much better than myself. I've had a company that cleans oil refineries using robotics and other innovations that I invent and patent. And I use vibration, resonance to remove fouling from the inside of pipes. And after my tenure with the company, I realized I was getting a few more aches and pains than expected. I had a broken neck, collarbone, broken collarbones, rotator cuff, slap tears, broken back in 4 places, hip joint displaced, 2 cysts in my kidney, 50% restriction in my arteries, ACL replaced on my knees, broken ankles and thumbs and fingers, etc. Partly from extreme sports, partly because of the work. And so I thought I'd look after myself for a while. And I happened upon a colleague of mine in Germany who said, you've got a big cyst on your elbow at the moment, try this ultrasoundy thing, he said. So I put my elbow on this mat, and 2 hours later, the cyst had disappeared, all but disappeared. That surprised me. Didn't think much more of it. A one-off, you don't think that much about it. And a few years later, I had a need for my ACL, which I'd snapped and had swollen up. And I used what I then found out to be PEMF on my knee. And sure enough, 2 hours later, the swelling went down and I was able to bend it for about 50%. And I was really amazed. A few years later, I had a major ski accident, broke my back, a lot of injuries. And with that, I had a lot of pain in my kidney and my ribs. And I sought out somebody with a single PEMF machine. And lo and behold, an hour later, I had no pain. This is after a few years of taking painkillers, 6 to be precise, almost every night just to sleep because of the pain. An hour later, no pain. A month went by, no pain. I immediately went to the manufacturer, got my air ticket and bought a machine, brought it back, and that was it. And selfishly, I used it for myself, just this one machine on different parts of my body, an hour at a time. And then, of course, guests and friends would appear, and one friend came in and he'd been crushed under a building. Another guy came 10 years ago and obviously a lot of aches and pains and arthritis. So I give him a 1 hour's treatment, and it was amazing. And by coincidence, my then wife had a spa. We worked together at the spa. And within a year, I was treating her patients and lots of friends and clients just for fun with one machine. Then I thought, what if? What if I used more than one machine? Because I have multiple areas of injury. So I thought, well, let's try two machines. So I tried one in each knee, and it worked just as well. Then I tried three machines, and then all manufacturers I spoke to were challenging me. He said, well, hold a second, you shouldn't reuse three machines or two machines even, because these are medical grade technologies. And I asked, well, why? And the answer came back, well, it's something we just don't do. From an inventor's point of view, that's not really the right answer you're looking for. It was the case of nobody had really pushed the boat out. And as an inventor, I really go to the extreme. And so I thought to myself, I'll try it on myself for about a 1, 2, eventually it was 3 years. I bought 4 machines, then 5, then 6, and I tried 7 machines, then 8 machines, then 9, and eventually I got to 10 PMF machines, learning simultaneously. Say again?
At one time?
All at one time, all at once, all 10 machines, using various intensities and various frequencies and durations and dwell times. That's very important as well. I didn't just glibly go into this. I researched the type of frequency, the sine cosinal wave, if it was a shark tooth, if it was a horizontal waveform, because each part of our bodies resonates at a different frequency. Now, we are all human beings, but we are all different. The density of our bone is different. You might have somebody who is obese and somebody who is slim. Therefore, their resonance, the frequency will change pertaining to their requirements. If both an obese person and a slim person have issues with, let's say, their kidneys or their ribs, the density of their tissue plays a major, major part as to what frequency and intensity and dwell time you use on that particular area. So I started using this on animals, first of all, and myself, of course. Occasionally, if I used a frequency too high, for example, on my chest, I found it was a bit of an achy feel. Not a dangerous ache, but certainly I would wait a little while and do it again with a different frequency. And I'd trial these frequency. And this was for 3 years, almost on a daily basis. Because the results I was getting were this amazing and this spectacular. This was beyond spectacular. And I say this because what happened during this treatment was I ended up being almost horizontal for a few months because of my back. And I decided to get myself a full health check. I wasn't getting any younger. And to be fair, the PMF was making me do things that really I didn't expect to do. As you said, Bill, it was like putting a cape on. I was doing things, I was playing tennis and football at the age of 58, 59, that a 25-year-old would do. I was playing table tennis and badminton and tennis as I used to do, and pushing the limits. So I got myself a health check, a heart scan, my knees, density, bloods, etc. And my cardiothoracic surgeon said, after the CT angiogram, he said, sorry to tell you, Mike, you're going to have to be on statins and blood pressure tablets for the rest of your life. It caused a bit of a shock, and I asked him why, and he showed me the CT scan showing me 50% of my artery was clogged. Whether that was hereditary or my bad diet, who was to know? So I looked at the frequencies. I did a trial on a pig, a long story short, 2 pigs actually, with a similar defect, let's just call it. And I noticed under about 3,000 magnification that the cells started resonance. Now, cells, as we know, when they clump together, it's called the ruler effect. And what I had blood in the arterial wall. It hadn't created macrophage inside the tube itself, the pipe itself. It was actually in the pipe wall. So I was lucky there, but obviously it was like a bulge on a tire. It was pushing into the internal bore of the pipe, therefore creating what we in the industry in the refineries call delta P, back pressure on the pump. And so similarly, this is back pressure going onto the heart. So I thought to myself, is it what I used to do in the oil refineries to unblock a crude oil pipeline, sometimes or remove what's called a heat exchanger from a pipe. I used to resonate the outside of a steel chamber in which this thing was inserted and resonate the actual exchanger itself at a different frequency. By doing that, it broke the shear force, broke the bonding, if you like, the adhesion, the bonding, the binding. And I could pull this heat exchanger out of this big steel chamber. And that's what I tried to do for myself. So I looked at the frequency. I looked in a lab, see what frequency would actually have impact on the blood, on the fine tissue, arterial wall, also on the epithelial layer of skin. And so it was interesting to see the different dynamics of the cells at different parts of the body. So I left it at that, and I thought, yep, I'm quietly confident that I could use this this pillow on my chest, and I used it at a certain, let's say, a bespoke frequency and intensity for about half an hour to begin with, and I continued to do this for about 7 months. I went back, maybe even longer, perhaps a year, just on and off, maybe once every week, once every 2 weeks, because sometimes it did ache. It was a bit concerning, but it's almost like it felt like a bruising. So I just played with the frequency a little bit. 7 months to a year later, I think it was, I went back to my cardio surgeon with my wife, and his first words were, "Nurse, I think I have the wrong details in the front of me. Could you check?" So I give him a national insurance number, name. He says, "Wow," he says, "this is unusual. I haven't seen this before." And he says, "You tell me, Mr. Watson, you haven't been taking your statins and your blood pressure tablets." And I said, "No, not at all. At the very beginning I did. It was too painful for my fingers, the side effects. So I stopped taking it and I used PMF. My diet hadn't changed my lifestyle much at all. But sure enough, I saw the CT angiogram. Well, it actually had reduced from 50% down to 20% occlusion, which was pretty outstanding. It's beyond spectacular, as I said. He offered to give a video interview. In that interview, he said, typically this increases 20% year on year, and I would have had to have a stent by now. So I was really amazed. He suggested we have double-blind trials. I'd use multiple machines, I might add. It's not just one in my chest, but I also did multiple machines around my body, because my theory and practice is that you might, wherever your ailment is, if you, for example, you have a crepitus and the cells stuck together because of injury or whatever in one area, that's all well and good. You can treat that area. But don't forget, your heart is pumping these blood cells throughout your body, entire body, and within a few seconds, it's coming round full circle to the same area. So it could almost create a logjam of other rouleaued or bonded cells together at that point. So what I prefer doing is treating the entire body and organs and other areas where you might have crepitus, because you want to make sure blood that passes here has gone through and gone past some kind of magnetic field, so as to increase the cellular potential in these blood cells, and thereby pushing them apart, as some of you might have seen on video clips, etc., when under dark field microscopy. And that's the main reason why I do that. So I do that for every ailment. So now the last...
Let me stop for a second. One clarification. What intensity ranges had you been using in the different equipment?
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pollack, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpollack.com PEMF systems. Visit drpollack.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpollack.com today, and let's get started on your healing journey together.
The intensities I've been using were between, I started with 1 to 3 hertz at an intensity of about 99%.
What intensity in terms of actual Gauss?
I'd have to look at my papers.
Guess. So if you do
the MAS, the MAS system, the MAS Austrian system,
right,
the Gauss on that.
The peak of the whole body pad is about 25 Gauss, and the peak.
Yeah, wasn't that?
And the peak on the pillow applicator is 100 Gauss.
Correct. I'd say this is such a long time since I've actually seen the report of the details. I suspect it was half of that, if not a quarter of that, because I prefer treating over a longer period of time to limit the perceived risk or the actual risk. So I'd say 5 Gauss maximum, if not less, but over a prolonged period of time. The results were suitable for me to continue doing it as a preventative measure. And I would say that using 4 machines simultaneously was the optimum protocol for using the system. I didn't use any high Gauss like the Tesla. I didn't use anything as high as the Teslas that you have yourself there, of which I've got numerous over here. I used 10 to between 2 hertz, 3 hertz, and then up to 10 hertz. I did play around with 100 hertz, but the depth of penetration wasn't as deep. That said, you don't need to go that deep either. And I was quite happy around about the 5 hertz area once I'd have achieved the 50% down to 20% restriction. And the logic behind that, I guess, is like a tube or a pipe in the industry whereby you have layers of fouling inside a pipe, and the closer it gets to the tube wall, the more tenacious it gets. And I'm presupposing that's probably the same case with regard to either plaque inside the pipe or within the actual wall of the artery itself. I've yet to check that. I yet to really look at that in detail.
I think that's absolutely true. So as you move away from the wall, what you get what's called fibrin deposits. So at the wall itself, there's attachment, and that attachment is based in a sense, it's like scarring or fibrosis. But as you move farther away from the wall itself, the plaque becomes thinner and thinner. And so you have what is called hard plaque and soft plaque. So toward the center of the blood vessel, then the plaque becomes more pliable, more softer, and more amenable to breaking up.
Okay. Yeah, it makes perfect sense because, as I say, my history for 37 years is in the oil industry with heat exchangers and pipelines, and that is typically the case where the inside of the formation of fouling, in this case, my arterial wall, it's very, very soft and squidgy, and that's easier to remove. That said, of course, there are cardiothoracic intervention surgeons using what's called shockwave therapy. I met one in London, and it's ironic we're using the same terminology. You know, I clean tubes and pipes in refineries, and he cleans tubes and pipes in the human body. Yet our terminology is very, very similar. And this shockwave therapy, I've used something similar to unblock crude oil pipelines, but using ultrasound with ultrasonic transducers, so to speak. These probes that go into the artery itself try to create a sound wave, a shock wave inside. Now that's all well and good. I hope I'm not digressing too much here, but with shockwave therapy, you really want something that is brittle, not ruberoid, not soft and pliable, because that simply absorbs the sound waves. You want something that actually creates impact. Yeah, exactly. The shockwave therapy, I may be speaking out of turn, but I don't think it's the right way to go. It has to be from the outside in and using soft manipulative waveforms, and then increase periodically and just monitor as you go along. And the key to this, I've been fairly regimented over the 3-4 years, almost on a daily basis, as I said, as long as you monitor, measure, and record and archive your details, you end up generally being very, very successful in whatever you're attempting to do. A lot of medicines and technologies are rarely monitored, measured, and recorded over a long period of time, except in the pharmaceutical industry, I guess, for 5 years when it's FDA required. But the PEMF is so varied, the Gauss output, the intensity, the frequency, and you can do this very, very safely. So I did this really, really slowly, really over a long period of time to get the specific frequencies that matched my body and that I was happy with. And on a regular basis, I'd say I use the multiple machines, up to 8 or 10 machines, probably once every 3-4 weeks. But I use 3 machines or 4 machines regularly, almost every other day. And my arthritis is next to zero. I have no pain. I just played an hour's tennis match with a top player yesterday. I'm lost for words at the results I've had from this. I can go on with other results if you want me to, but I'm very, very impressed with it.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that. Recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
Let's go back to shockwave for a second. Shockwave therapy is increasing in popularity. It originally started with what we call lithotripsy for kidney stones. And the idea with the kidney stones and with lithotripsy is that they have to actually put people under anesthesia and monitor their hearts while they were doing the lithotripsy. So what they were doing is they'd be banging the body with these shock waves. And the purpose of the shock waves was to break apart the stones.
The only shockwave method that I know of to break up stones is one with using a laparoscope, which actually goes in with a biopsy forceps and actually grabs hold of the stone and then applies ultrasound shockwave therapy, as you say, specific to the stone. Now, the stone is very, very brittle. And by using high-intensity shockwaves, it's able to shatter the stone, meet the desired frequency for that. It's a variable frequency until the pinpoint frequency is achieved, and then it just breaks it down. So that biopsy forceps, actually like a claw, grabs it, and then breaks it up, and then slowly is able to bring it out through the scope, the borescope. I don't know of any I'm unaware of any external shockwave therapies, because I would suspect that would be detrimental to other parts of the body unless it was somehow focused.
Had to be done under anesthesia. It was usually done in a bath.
Yes, makes sense.
Bombard the abdomen with this. It was not so good for higher stones because then you damage the kidneys as well. That's called shockwave lithotripsy. This is as opposed to the kind of lithotripsy that you're talking about, or shockwave therapy that you're talking about, which is very local. And that still requires an invasive procedure to be able to do that. Although shockwave now is used on tendons and ligaments and wrists and elbows and so on.
And it stimulates the blood flow.
It does stimulate blood flow because, again, you're stretching the tissues, that you're pushing the tissues, but it also causes swelling. And one of the benefits of PEMFs for your blood vessels is that they not only decrease the clotting from happening, but they also do something called fibrinolysis. So fibrinolysis means they actually break down the fibrin. So when you develop a clot in your leg, your body then has to try to get rid of that clot by doing fibrinolysis. And PEMFs have the dual action of preventing the clotting in the first place, and then they additionally do the fibrinolysis. So all of those benefits happen from the PEMF simultaneously, basically.
Without question, because notice shockwave therapy, it requires a sound wave of sorts to try and penetrate the body, and eventually, obviously, over distance, it diminishes exponentially. And when you use shockwave, all it's doing is it's just bombarding it, as you say, in order to try and loosen it up. The beauty of PEMF, and I call it enhanced PEMF or intensive PEMF, is that it not only oxygenates the body by virtue of breaking open the stuck cells, the Rouleau effect from these stuck cells, by increasing the cellular potential of these cells. In layman's terms, any viewer, it's like having crocodile clips on the battery of your car, giving it more energy. Because at the moment your cells start sticking together, you're not allowing these cells to release the oxygen and nutrition into your body. Now, of course, if you're the kind of guy or girl that has 10 Mars bars and 5 pints a day, you're going to have a lot of sticky blood, and your cells are going to stick together. And the analogy there would be you've got a Mini and you're trying to tow a truck. So your truck is your body. It's too large. It's cumbersome. It's not working properly, and you're trying to move around and pulling it with a small miniature car. So the engine is overloaded. The battery will get drained after a while with all the force and the exertion. Increasing the cellular potential, it opens up these cells, delivers the nutrition and oxygen to the much needed oxygen to the organs, and helps them perform. But if you keep on, and that's just periodic, that'll only last for a little while, you have to in parallel look at your lifestyle and diet. because if you keep on putting sticky stuff into your blood cells will naturally flow very slowly down your bloodstream and stick together. And as they go through your bloodstream, there are single capillary pipes, in simple terms, that goes to your kidneys, your liver, etc., and your organs. And these clumps of cells, these capillaries are only single cell capillaries. So your blood cells literally just go down one pipe and then it delivers oxygen on a regular basis. You have trillions of these cells in our body, but if they're clumped together, they will simply float past this one single pipe that is meant to have this oxygen, this blood cell, and it'll keep on going. So we all suffer from the same problem, and you'll find slim people, less obese people with a healthy diet tend to have watery blood, let's just say, less viscous blood, where your blood cells can float randomly and indeed nutrify the organs by doing so.
I totally agree with what you said, and that's coming from an engineer who is not a physiologist or a medical doctor. So even from an engineering perspective, they certainly overlap. I'd like to go back to the intensity question and the amount of treatment time. So you're doing a lot of treatment time. And one of the reasons that we need to do a lot of treatment time when we use lower intensity systems is because they need to produce their effects gradually over time. And so when, like lithotripsy, you need a very strong lithotripsy force to be able to create the reaction that you need, or whether you're working with pipes. So frequency by itself is not enough. It's got to be the right intensity of the frequency as well, right? So I'm going to share my screen for a second, if you don't mind. Here's a graph from a research study that looked at people who had PEMF therapy for fractures that wouldn't heal. So these are fractures in the forearm, fractures in the tibia fibula, fractures in the scaphoid, which is in the hand. These are fractures that commonly don't heal properly once you have them. It's not that common, but it's common enough, and it's usually a disaster. So what happens is the treatment for this particular system it's an FDA-approved device, which is about 15 pulses per second, and they used 18 Gauss, right? So, and they were recommended to do 10 hours a day. So what happened is they interviewed 170 of these individuals to find out whether they had done 10 hours a day of treatment, and then looked at how long it took to heal. So what they found is that people who did greater than 9 hours a day healed 76 days earlier than the people who did only 3 hours a day or less than 3 hours a day. So they took 112 days to heal their yawn union. People who did 6 to 9 hours a day healed 41 days earlier. People who did 3 to 6 hours a day did 29 days earlier. And then the people who did 3 hours or less a day took 188 days, in other words, 6 months to heal their fracture. So the treatment time becomes critical to healing these kinds of fractures. Now, some people are much more severe than others, so there's a lot of variability there. But this gives you some data about some comments that people make frequently is you can overtreat. And this is the point that you're making, is it's hard to overtreat, actually, especially when you're using lower intensity devices. In this case, again, this system was 16 Gauss at a time, applied right over the fracture site, right? And so the more treatment time, the faster the healing. And there's basically no risk.
I agree, because the experience that I've had with treating quite a few people with breaks, complete fractures as well, and I have a few video testimonials. I'm not for video testimonials where I'm entering a field that, as an engineer, as an inventor in my field of oil and gas, the medical field I'm not as familiar with, but with an inventive research mind, I really do go into the details, especially when it's selfishly for myself. But after 3 years of daily experience and research, I started helping those that have had broken arms, limbs, etc. And the results were astonishing, mind-blowing, where you'd often hear, they'll show me the x-rays, and I kind of read some x-rays, but it's not my place to read an x-ray, but I simply say, well, let's try it at this intensity. This is what I feel would be. I've read your book, I've read other metadata and peer-reviewed papers, and sure enough, the average healing time was, worst case, twice as fast, best case, 4 times, 5 times faster. And this was after probably just 4 treatments, but fairly long treatments, low intensity, low frequency. And the cliche is less is more. I've often heard mentioned that, some people argue intensity is better. Some say frequency is better. With respect, I'd say neither are true. It's a true combination of the two, dependent on the ailment and dependent on the patient and their conditions and their environment. There's a plethora of circumstances that you need to address, and not just say, no, mine's intense, better than that one. Mine's got more frequency, that's better than this one. In my opinion, that's wholly untrue, and it just distracts from the true worth of the technology.
And I think that's a really important point. So whatever system you have, and you may have a high intensity system, you may have a low intensity system. If you understand what you just said, is the problem determines what you need to do for it. And then you have to understand the technology that you have. Once you understand your technology, then you can adjust your treatment protocols to deal with a problem and to get the best results the fastest. The good thing about PEMF therapy is it's almost impossible to do harm, because we use extremely intense magnetic therapy devices that are approved by the government to treat the brain for depression and Parkinson's and multiple sclerosis, all sorts of other neurological conditions. And they're using 4,000, 7,000 Gauss machines, where they're stimulating the motor cortex and they're causing the hand to contract by stimulating the brain. So that's a very indirect action. They're causing the brain to cause the hand to contract. They're not stimulating the hand directly. You need a lot of power to do that. And then they're taking that power, that's called the motor threshold, and they're putting it over the front of the head, treating the brain for depression, for example. So, and these have been found to be extraordinarily safe. 4,000 Gauss magnetic fields that are beyond motor threshold. So it's very hard to do harm with magnetic field therapy. And magnetic fields are more likely to reveal a problem than they are to cause a problem.
I wonder whether a lot of people imagine the risk to be quite high, thinking that we are a static, immobile, solid mass, whereas we are in fact a living creature. Our cells are constantly reproducing. As we get older, they will reduce less, of course. And a good point in question, I'll give you a terrific example. A couple came in with their 7-year-old child who had a very, very rare brain glioma, a brain cancer. And they were out of sorts. They tried everything else and failed, trying to get a lot of funding to go to Mexico, China, try an alternative treatments. And as many of us now know, chemotherapy tends to destroy more tissue than it saves, unless it's pinpointed, etc. But that's another conversation. And the reason why I know a lot about oncology is that I worked with the Leukemia Research Foundation. My eldest child had leukemia when she was 2.5 and had acute lymphoblastic leukemia. So I studied oncology like there was no tomorrow. And I worked with the professors and the oncologists at the Great Ormond Street and devised a protocol for my daughter. She's a healthy, lucky 30-year-old, others not so lucky. So when I hear about oncology patients, my ears immediately prick up. So I know what happens to the body. I understand very, very a deep understanding of how the cells react to chemotherapy, to various waveforms. And one child didn't make it because they used chemotherapy injected in the brain. And I suggested with one patient, I said, well, why don't we try the PEMF machines? But the protocol is morning, noon, and night. Not just once a day, but morning, noon, and night. So I gave this gentleman to apply his daughter. She was about 8 at the time, and she had about 6 months to live. That was the prognosis. And she used these two machines, morning, noon, or he used it morning, noon, and night. Nutrition was great. He's a very, very disciplined individual, which helps an awful lot. And she is now, I think, 4 years still doing the treatments with these two machines. And in that time, I noticed there's a lot of headway being made with wearable caps using stimulated pulse magnetic field. That is without question the way to go. And the reason why I'm so confident of this is I say very, very simply to people with conditions like this. Cancer likes a little bit of oxygen. Cancer hates a lot of oxygen. That's as simple as that. And so if you take that analogy and look at yourself in the mirror and ask yourself, am I obese? Am I morbidly obese? Am I unhealthy? Do I oxygenate myself? Do I drink the right thing at the right time? How do I eat? When do I eat? All these things need to have tick boxes against them in a kind of an Excel spreadsheet, and just See what kind of person you are, what environment you put yourself in. Are you in front of a computer screen? Are you sedentary? Do you sit? Do you stand? Do you walk? Do you socialize? Do you drink? Do you eat sugar? All these different things. And this will dictate how successful a machine like this can be and will be over a short or long period of time. It's incredible. The relationship is just so simple. I do it every day, and I see that I know exactly who's going to have success 90% of the time, who's going to have success with it and who's not.
Now, for the children, when you were treating the gliomas to the brain, where were you treating?
It was behind the neck, the pens area of the neck. So the pillow would be the mass system would be behind the neck, and also on the mat. So I would make the whole body, because I'd make sure we have 6 or 7 nodes in the mat at low frequency, not high. And I'd make sure that he would double check the magnetic field by putting it on her neck, because the pillow's magnetic field is strong enough to resonate through the neck. And you can see with a simple magnet, the vibration, and just confirm it's 1 to 3 hertz or 10 frequency or 10 hertz. We have to be mindful of the hertz frequency, because if you do this to a too high hertz frequency late in the evening, it's very difficult for the patient to sleep. The lower the frequency, you sleep like a log. It's lovely to see.
Now, you use the MAS a lot from what you were saying. I know that you do have the Tesla Fit machines as well. How do you decide which one you're going to use?
When it's a soft tissue condition, if it's a neurological condition, for example, it might be fibromyalgia, I always use the PEMF MAS system. Less is most definitely more. When it's a musculoskeletal trapped nerve kind of situation where they've had it for a long time, I use the Tesla Fit, or I call it the Big Bertha, for about 5 minutes to kind of knock it out the ballpark. First of all, we have to be mindful, of course. The first 2 questions to ask is, do they suffer from psychosis because of ill effects from recreational drugs, and do they have a pacemaker? These are very, very important things. I have treated somebody with a pacemaker, not on their chest, of course, but down by their legs. The frequency is measured using a digital analyzer, and the frequencies are very, very low, at low intensity of frequency, sufficient to treat the legs and the lower extremities, and nowhere near the heart. The Tesla Fit I tend to use on joint aches and pains, and then I combine it with the lower intensity MAS system, because first one is there to almost like throwing rocks at a wall. With the MAS, it's throwing pebbles at the wall. It's a nice analogy, because you want to immediately get rid of the pain. It diminishes pain very, very easily in a short space of time, the Tesla that is, as does the MAS, but it takes half an hour to an hour. So I use a combination approach more often than not, there's a downside to that, which is cost. Because obviously using 2 machines are very expensive. The Tesla machine is quite expensive, as is the MAS, slightly less expensive. But combined, which is the optimal treatment, in my personal opinion and experience, it comes in at a cost sometimes people might not be able to afford. That said, for 3 years, I've been treating people free of charge. I don't charge very, very little.
Well, you can afford to do that, thank goodness.
It's nice to do.
Let's go back to the pacemaker. That is a general contraindication, as is any implanted electronics. Although you should go with that rule, but you could determine whether the pacemaker or the implanted electronic machine is MR conditional. So the newest devices over the last 5 to 10 years, particularly over the last 5 years, they've been engineered to be able to withstand an MRI machine. And so these devices, the MR conditional machines, can go up to about 15,000 Gauss.
Well,
so if you have an MR conditional device, you're okay to use the magnetic systems that you're describing. Now, if you go to a very high level machine, and there are some that go up to 10,000 or 15,000, then you might have to be more concerned. And of course, if you stay in pacemaker, you should be okay.
It's interesting. If you were to use a digital stress analyzer and walk around an airport, for example, and you to switch this thing on, the radiation, electromagnetic field radiation that you get in an airport exceeds that of these machines. Nobody ever questions whether you're walking past these cameras when you have a pacemaker. No. Secondly, when you're sitting on a seat in a modern day car, if you've the engineers out there have ever taken the car apart and look at the wiring looms inside a car, you are constantly bathed in electromagnetic field from a wiring loom on a car equal to that of a mobile phone. I use a mobile phone to my head. I measure it. It's in the 2.5 watts and gigahertz field, and yet you're sitting on this almost like for 1 to 5 hours driving. It's insane. People with or without pacemakers, and it has no detrimental effect. So it's the intensity is key. The more intense, deeper, the further the distance of this frequency that you're using will penetrate. So I think in that sense, I find that using low intensity, low frequency is good enough over a long period of time to minimize any perceived or actual risk. It's just so low. Less is definitely more when treating things like that.
Especially over longer periods of time.
Indeed. Yeah.
We're at the end of our time here. Do you have any parting thoughts or comments?
With Inventor hat on, I do believe there should be a lot more double-blind trials done, organ-specific. My cardiologist said we need to do double-blind trials on the amazing results I had in my heart. Similarly, for spines, I've injected stem cells and platelet-rich plasma into my spine and combined magnetic field and seen the results under dark field microscopy. I do that before, during, and after to see the actual cell structure before and after treatment on a big screen. Also, I'll be doing this myself regardless. And also, I'll be developing a wearable device specific for areas of the body. Because as I said, I have multiple issues myself. This is purely selfish. And I'll be creating it. I have a research, my own Watson Innovation Center and Research and Development Hub, where I can do this and act out my Tony Stark vision to have my own research and development hub. And I got 30,000 students at my disposal with Dresden University and Imperial. And I would hope to develop a wearable so that this too, because now FDA approved in many instances, will be not just curative, but preventative. And add to which this absolutely essential parallel is nutrition. Without question, you can have a short-term result, but you will not have a long-term gain if you don't match both with PEMF and nutrition at the same time.
I totally agree with that. You can't build a house without bricks and mortar.
There you go.
You don't have the nutrients, you can't fix and repair and regenerate. I look forward to hearing more about your innovation, and we'll have to stay in touch so that we can help you to promote your devices, your next technologies.
I look forward to it, and I look forward to anybody who wakes up at 3 o'clock in the morning with a box of milk tray chocolate on their lap and can't sleep and thinking, I wonder if, as long as it's crazy and seemingly impossible, I'd like to hear from them.
So how can people get in touch with you?
They can email me at mike.watson@watsonmedical.com. Give me a call on my mobile phone, UK 07825 888 000.
Well, mike.watson@mikewatsonmedical.com, right? Mike.watson@watsonmedical.com.
There you go.
Thanks again, Mike, for taking your time out of your wonderful day there. And I think you're in France, I believe.
We are indeed. Not so sunny today, but generally sunny south of France.
Enjoy. Be well.
Enjoy. Take care of yourself.
Yeah.
Thanks very much.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.